Welcome to a mini course on how to use Fair Choices DCP Analytics tool. I'm Kjell-Arne Johansson, professor in Bergen Center for Ethics and Priority Setting and leading the Fair Choices work. We have organized Fair Choices as a web-based tool. You can access it from our webpage, fairchoices.org, access Fair Choices, and you will get this to this link. We have a range of tabs that you can move around to, and I will guide you briefly around these. First, you need to choose your country. We have 82 low and low middle income countries. Data will be uploaded depending on what country you have. You can go to the disease burden tab. You can go to the budget space tab. But I will now start at the benefit package tab, and I will not go in detail into every tab, but every tab has instructions and an icon like this. So you can read how to use it and more details about the tab, looking at the instructions, so they should be self-explanatory. The interventions are organized in a cluster of 22 or so interventions. We have everything from surgery to emergency care, reproductive health, maternal and newborn health, child adolescent health, HIV, malaria, TB, neglected tropical diseases, infections in general, cancer, CVD, musculoskeletal disorders, and the like. And if you want more information what is underneath each cluster of interventions, you click on the dot, and then you will see the interventions popping up like a tree. We have 4 types of emergency care interventions. We have first aid, emergency care basic, emergency care advanced, and then you see what the interventions are packed into each of these categories. And you click on the dot to get this information. So when you click on a dot, this is also reflected in the table below. And now I clicked on acute orthopedic management, and then you can see information on the cost effectiveness rate, the ICER. That's how many dollars does it cost for one healthy life year gain. And you can see that the whole package is at 2,371. But then urgent orthopedic management of injuries, for example, open reduction and internal fixation, has an ICER of 556. And fracture reduction external fixator traction has an ICER of 1167. And you can watch interventions underneath each of these intervention categories. But if you want to activate the interventions in the node, you have to click on it. And then now I'm at the base of all interventions we have in Fair Choices, and you could give them a priority by setting target coverage. You can set it at 60%, 70%, 100%, and now I will just give universal coverage for all interventions in Ethiopia. You could also do it manually at each intervention, and then you have to stand in the tree and click on what coverage you want to give it. But you basically go from the baseline coverage that you have that we have as input in the template here. And this is the baseline coverage for Ethiopia that we use as starting point is displayed here. So it's 5%, 1%, it's 27%, 39%. And now you can see I gave all these interventions full priority, 100% coverage. That means universal health coverage. Of course, we would want you to work together with you on parameterizing the model. So ideally, you should collaborate with us in BCEPS to both parameterize the model to have more precision in the analysis and contextualize the model, but also if you would want to develop some kind of analytics for your needs, we can do that together. But the data you would need to parameterize is epidemiology, demography, costing, and baseline coverage. Those four types of data is crucial for the analysis. We have provided some input as a template, as a starting point. For epidemiology, we use global burden of disease, and you can see more on the details about the epidemiology in the Epi tab, but that's basically global burden of disease, and you can see the overview at the disease burden tab. But if you want to know what a full package in Ethiopia looks like, this would be the cost. So you would have to increase the health budget over 10 years with $47.4 per capita. And that is basically more than a doubling of the health budget. And maybe not a realistic and feasible scenario. And to assess what is a feasible scenario, you can analyze that in the budget space tab, and you can a video will come later on how to use the budget space tab, but for now you can use the instruction icon and see how to perform it. But you also get information about the Healthy Life Years game, and you get this information by program. And the ICER is, you can rank order the interventions by ICER, and you can see that maternal and newborn health interventions are the most cost-effective. Child adolescent health is second most cost-effective. If this is an unrealistic package, the cost effectiveness of the whole package is $165 per capita. If you want to start from scratch again, you go back to the benefit package. Now you can check here if you are at the anchor of the tree and we have all interventions activated, and you can go back to no change. And we can now choose a package that is the most cost-effective package. Then you go to the league table and you can rank order intervention by their cost effectiveness. You click on the ICER, and now you get the most cost-effective interventions at the top. And you can simply click on it, and then you can go down to as far down to the ICER that you think your country would be willing to pay. We can maybe go to, let's assume that the willingness to pay in Ethiopia is $201.2 per healthy life year gain. And now you're applying the health maximization principle. And if you want to give these interventions that you have marked, you do that by clicking the first one, and then you hold shift, and then you go down, and then you click all interventions. And then you give them priority, but then when you're in the league tab, you have to click twice on the target coverage you want to achieve. And you can go back to the program summary to see how that would look like. And this is a much cheaper package. The cost effectiveness is $21.5 per healthy life year. And you would have to increase the health budget by $5.2 per capita. And you would get 26 million healthy life years over 10 years. You can also look at the demographic impact of the package. And then you can look at how it would influence life expectancy and how it would influence other parameters. And all the other tabs, it's explained more detailed in the longer video, but more videos will come where we will go into details for each of the tabs. But during at 1st of July, version 2.3 will be launched, and that has some better features than what you see now in version 2.2. And then we will make several videos that will be hopefully help you to get started with using the tool and understand how you can parameterize the tool And this is, of course, something we do together. And also important is that the tool should be used in a process with all stakeholders with an expertise on the input you need, and also those that will be affected by the decisions that you have learned at the course. Thank you.